Good morning, everyone. My name is Prina Jose. I am going to present practice change using critical thinking. Firstly, we will see what is critical thinking. In modern nursing practice, especially in this pandemic time, nurses use critical thinking to give a effective care to the patient. Critical thinking is a higher level thinking to assess the situation, analyze the patient problem, examine the evidence based practice in caring for the patient, and make an option in the delivery of the optimal care. To become an ideal critical thinker, nurses should be open minded, flexible, and orderly in complex matters, diligent in seeking relevant information, and to be reflective in her practice. Next is clinical reasoning and clinical judgment. Critical thinking is related to clinical reasoning and clinical judgment. Clinical reasoning is a process by which nurses and other clinicians make their judgment, and it is a deliberative process of generating alternatives and choosing the most appropriate pattern. Clinical judgment is a development process in which nurses make a clinical decision about the care of the patients, families, or communities, and it is a complex observation outcome that includes critical thinking, problem solving, ethical reasoning, and decision making. In clinical reasoning, nurse may consider many pieces of the information to view a patient's situation holistically. It is possible through the critical thinking. In clinical reasoning, nurse compare a patient's present situation to the desired outcomes. So, the reasoning of the nursing intervention will promote the outcome. Therefore, we can say that clinical reasoning is an integral part of the patient care to give safe, efficient care to the patient by nurses. Successful clinical reasoning and decision making require a balance of intuition and evidence based thinking to make an effective clinical decision. The nursing process itself, standard 1 to 6, essentially a tool used for the clinical reasoning. More experienced nurses use a holistic approach to deciding a case compared to the novice nurses, as they have many knowledge and experience about the patient care, and they are good in patient advocacy, which aimed to protect the patients from the harm, especially for the vulnerable and uninformed patient. That is the end of my presentation. Thank you.